Hello, friends. Here we are again, with a new healthcare topic, that is infertility. But before starting this topic, we want you to please subscribe our channel, to have more helpful and informative videos in future. So, today we will be going to discuss all about infertility. That includes 1. What is infertility? 2. Infertility causes. 3. What could be the symptoms of infertility? 4. How common is infertility? 5. Types of infertility. 6. Risk factors of infertility. 7. Diagnosis and tests for infertility. 8. Management and treatment of infertility. 9. Prevention from infertility, and 10. Infertility prognosis. So let's start with that. What is infertility? It is defined as not being able to get pregnant or conceive after 1 year or longer of unprotected sex. Because fertility in women is known to decline steadily with age, some healthcare providers evaluate and treat women aged 35 years or older after 6 months of unprotected sex. When the woman is older than 35, the amount of time trying to conceive drops to 6 months for an infertility diagnosis. In women over 40, immediate evaluation is warranted. Infertility does not include miscarrying or being unable to carry a baby to childbirth. What causes infertility? All of the steps during ovulation and fertilization need to happen correctly in order to get pregnant. Sometimes the issues that cause infertility in couples are present at birth, and sometimes they develop later in life. Infertility causes can affect one or both partners. In general, in about 1/3 of cases, there is an issue with the man. In about 1/3 of cases, there is an issue with the woman. In the remaining cases, there are issues with both the man and the woman, or no cause can be found. What are the causes of male infertility? Let's discuss. These may include abnormal sperm production or function due to undescended testicles, genetic defects, health problems such as diabetes or infections such as chlamydia, gonorrhea, mumps or HIV. Enlarged veins in the testes or varicocele also can affect the quality of sperm. Problems with the delivery of sperm due to sexual problems, such as premature ejaculation, certain genetic diseases, such as cystic fibrosis, structural problems, such as a blockage in the testicle, or damage or injury to the reproductive organs. Overexposure to certain environmental factors, such as pesticides and other chemicals and radiations. Cigarette smoking, alcohol, marijuana, anabolic steroids, and taking medications to treat bacterial infections, high blood pressure, and depression also can affect fertility. Frequent exposure to heat, such as in saunas or hot tubs, can raise body temperature and may affect sperm production. Damage related to cancer and its treatment, including radiation or chemotherapy. Treatment for cancer can impair sperm production, sometimes severely. What are the causes of female infertility? Let's learn. Causes of female infertility may include ovulation disorders, which affect the release of eggs from the ovaries. These include hormonal disorders, such as polycystic ovary syndrome. Hyperprolactinemia, a condition in which you have too much prolactin, the hormone that stimulates breast milk production, also may interfere with ovulation. Either too much thyroid hormone, that is, hyperthyroidism, or too little, that is, hypothyroidism, can affect the menstrual cycle or cause infertility. Other underlying causes may include too much exercise, eating disorders, or tumors. Uterine or cervical abnormalities, including abnormalities with the cervix, polyps in the uterus, or the shape of the uterus. Non-cancerous or benign tumors in the uterine wall, that are, uterine fibroids, may cause infertility by blocking the fallopian tubes or stopping a fertilized egg from implanting in the uterus. Fallopian tube damage or blockage, often caused by inflammation of the fallopian tube, which is also called salpingitis. This can result from pelvic inflammatory disease, which is usually caused by a sexually transmitted infection, endometriosis, or adhesions. Endometriosis, which occurs when endometrial tissue grows outside of the uterus, may affect the function of the ovaries, uterus, and fallopian tubes. Primary ovarian insufficiency or early menopause, when the ovaries stop working and menstruation ends before age 40. Although the cause is often unknown, certain factors are associated with early menopause, including immune system diseases, certain genetic conditions such as Turner syndrome, or carriers of Fragile X syndrome, and radiation or chemotherapy treatment. Pelvic adhesions, bands of scar tissue, that bind organs that can form after pelvic infection, appendicitis, endometriosis, or abdominal or pelvic surgery. Cancer and its treatment. Certain cancers, particularly reproductive cancers, often impair female fertility. Both radiation and chemotherapy may affect fertility. Now, we will learn, what are the symptoms of infertility? The main symptom of infertility is not getting pregnant. There may be no other obvious symptoms. Sometimes, a woman with infertility may have irregular or absent menstrual periods. In some cases, a man with infertility may have some signs of hormonal problems, such as changes in hair growth or sexual function. Most couples will eventually conceive, with or without treatment. How common is infertility? An estimated 1 in 10 women, between the ages of 15 and 44, have trouble conceiving. Women who have pregnancy problems may lose the baby before the 20th week of pregnancy, that is miscarriage. After the 20th week of pregnancy, that is stillbirth. What are the types of infertility? Types of infertility include primary infertility. A woman who was never pregnant and who can't conceive, after 1 year of not using birth control. Secondary infertility. Secondary infertility occurs when a woman can't get pregnant again, after having at least one successful pregnancy. Now, we will discuss the risk factors for infertility in succession. These factors increase the risk of infertility in all genders. Age, over age 35 for women, or over 40 for men. Diabetes. Eating disorders, including anorexia nervosa and bulimia. Excessive alcohol use. Exposure to environmental toxins, such as lead and pesticides. Over-exercising. Radiation therapy, or other cancer treatments. Sexually transmitted diseases or STDs. Smoking. Stress. Substance abuse. Weight problems including obesity or underweight. What are the risk factors for female infertility? Let's study. These factors can contribute to female infertility. Abnormal menstruation. Blocked fallopian tubes. Celiac disease. Kidney disease. Past ectopic or tubal pregnancy. Pelvic inflammatory disease. Pituitary gland disorders, such as Cushing's syndrome. Polycystic ovary syndrome or PCOS, ovarian cysts and primary ovarian insufficiency. Sickle cell anemia. Uterine problems, including endometriosis, uterine fibroids, and uterine polyps. Thyroid disease. What are the risk factors for male infertility? We will learn them one by one. These factors can cause male infertility. Enlarged veins, that is, varicocele in the scrotum, the sac that holds the testicles. Genetic disorders, such as cystic fibrosis. High heat exposure to testicles, from tight clothing, or frequent use of hot tubs and saunas. Injury to the scrotum or testicles. Low sperm count, or low testosterone, or hypogonadism. Misuse of anabolic steroids. Premature ejaculation, or retrograde ejaculation, in which semen flows back into the bladder. Testicular cancer and treatments. Undescended testicles. How infertility is diagnosed, and what are the different tests for infertility? Let's discuss. Your healthcare provider may ask you to record signs of ovulation, such as basal body temperature and cervical mucus. You may also use a home ovulation kit. These tests can also help diagnose or rule out a female fertility problem. Your provider will perform a pelvic exam, including a pap smear, to check for structural problems or signs of disease. A blood test can check hormone levels, including thyroid hormones. In transvaginal ultrasound, your doctor inserts an ultrasound wand into the vagina to look for problems with the reproductive system. In hysteroscopy, your provider inserts a thin, lighted tube, that is, hysteroscope, into the vagina to examine the uterus. In saline cynohysterogram, or SIS, your provider fills the uterus with saline or sterilized salt water and conducts a transvaginal ultrasound. A full uterus makes it easier to see inside the uterus. In hysterosalpingogram, or HSG, X-rays capture an injectable dye as it travels through the fallopian tubes. This test looks for blockages. In laparoscopy, your provider inserts a laparoscope, or thin tube with a camera, into a small abdominal incision. Female pelvic laparoscopy helps identify problems like endometriosis, uterine fibroids, and scar tissue. How is male infertility diagnosed? These tests can help diagnose or rule out a male fertility problem. Semen analysis checks for problems with sperm, such as low sperm count and poor mobility. Some men need a needle biopsy to remove sperm from the testicles and test it. For most men, this is the only test that will be needed in the workup of infertility. A blood test can check testosterone, thyroid, and other hormone levels. Genetic blood tests look for chromosomal abnormalities. An ultrasound of the scrotum identifies varicoceles or other testicular problems. When should you seek help for infertility? A woman's chances of getting pregnant decrease with age. Women under the age of 35 who aren't pregnant after 1 year of trying should see a healthcare provider. You should seek help sooner, after 6 months of trying, if you're older than 35. A 30-year-old woman is half as fertile as a 20-year-old woman. Regardless of gender, you should seek help early if you have a risk factor that affects fertility. How is female infertility treated? Treatments for infertility include: fertility drugs change hormone levels to stimulate ovulation. Surgery can open blocked fallopian tubes and remove uterine fibroids and polyps. Surgical treatment of endometriosis doubles a woman's chances of pregnancy. How is male infertility treated? Treatments for male infertility include: medications can raise testosterone or other hormone levels. There are also drugs for erectile dysfunction. Some men need surgery to open blockages in the tubes that store and carry sperm. Varicocele surgery can make sperm healthier and can improve the odds of conception. What are fertility treatment options for all genders? Some couples need more help conceiving. To increase pregnancy odds, a woman may first take medications to stimulate ovulation before trying one of these options.
In intrauterine insemination or IUI, a healthcare provider uses a long, thin tube to place sperm directly into the uterus.
In vitro fertilization, or IVF, is a type of assisted reproductive technology or ART. It involves harvesting the eggs at the end of the stimulation and placing sperm and eggs together in a lab dish. The sperm fertilize the eggs. A provider transfers one of the fertilized eggs, that is, embryo, into the uterus. Intracytoplasmic sperm injection or ICSI is a procedure similar to IVF. An embryologist, who is a highly specialized lab technician, directly injects a single sperm into each of the harvested eggs, and then a provider transfers an embryo into the uterus. In third-party ART, couples may use donor eggs, donor sperm, or donor embryos. Some couples need a gestational carrier or surrogate. This person agrees to carry and give birth to your baby. Men and women can take these steps to protect their fertility, especially while trying to conceive. Eat a well-balanced diet and maintain a healthy weight. Don't smoke, misuse drugs, or drink excessively. Get treated for STDs. Limit exposure to toxins. Stay physically active, but don't overdo exercise. Approximately 9 out of 10 couples get pregnant after undergoing fertility treatments. Success rates vary, depending on the cause of infertility, the couple's ages, and other factors. In general, each IUI attempt has a 20% success rate. An estimated 1 in 2 women, under the age of 35, conceive with ART. That number drops to 1 in 30 women, that is, 3%, for women in their early to mid-40s. Thank you so much for your time and attention. We really hope that this video would be helpful for many people who are struggling with infertility challenges. But just remember that, never lose hope. We know that infertility challenge can affect your relationships and emotional health. Infertility treatments can also be costly and strain your finances. Your healthcare provider can determine the cause of infertility. This first step helps determine the best treatment to help you succeed in expanding your family. Most couples eventually get pregnant, but some turn to adoption. Your provider can review options with you. Thank you.